everybody. Since I'm in person, I guess I won't miss out. Let's go ahead and do the roll call. So we'll start with Zoom people. Amy?
Here.
All right, Jason?
Here.
All right. Robert? Here. Harshan? Here. Ted? Here. Bridget?
Here.
Aaron?
Here.
All right. I think that was everybody here. Hopefully everybody will move on to section 2. Hopefully everybody's had a chance to look at the agenda and minutes. I hope to propose a minor change to the agenda. And that is to move the new business, which is the presentation from Council Member Piedmont Smith, up after the reports. So basically we would flip section 4 and 5. So we do new business before old business.
Sounds good.
Yep, sounds good. All right, and I always forget if we do a quick vote on that, but it looks like it was seconded. So. All right, so I guess we'll do a quick vote for approval on that. So, Jason?
Yes. Approve.
Amy?
Me?
Yeah.
Oh, aye.
Okay. Kale?
Yes.
Harshan? Yes. All right, Bridget?
Yes.
And Aaron?
Yes.
And I vote aye. All right. So that passes. So now we'll move on to the reports. So we'll start out with co-chairs. I guess.
Yeah.
Who wants?
Do you want me to go first?
Whichever. Go for it.
Yeah. So in terms of my report as a co-chair, I don't know if our time as co-chairs is officially coming up, but we should. I think we should consider electing new co-chairs next meeting. Part of the reason for that, and I'll announce mine, is that I don't plan on renewing my application to be on the commission for next year, because I'm taking on some roles, and being on this, I don't think it's responsible for me to be on this commission. Although I will still be in Bloomington and still be available to speak to things from previous iterations of the commission as needed. In terms of the current work that we're doing, I've been informally in talks about the report, but not acting on behalf of the commission. But I think that as long as we get in place some of the things that we've been trying to do, that will still move forward. I think that's all for me.
All right. So for me, yeah, I actually have basically a similar announcement. My appointment comes up in January. And I'm not going to be renewing because I'm going to be relocating. And I was gonna talk about the co-chairs, so I'm actually glad that we're wanting to bring that up for the next time. I think that should definitely be done. And I think that's it for that. Does anybody from the other members need to report out on anything?
No.
Right, we don't have any standing committees. So we'll move on to our staff liaisons. You guys have anything to report on?
No, go ahead. Okay. So we noticed that there's a meeting on December 18th that's already scheduled. But due to our staff schedule and the upcoming end of the year process and procedure that we have to go through with council's office, we won't be able to operate that meeting that date. So we are thinking it might be easier to schedule another meeting or reschedule that meeting to January directly. And we'd like to see if we can discuss this meeting and then find a date that's available for everyone.
So that does,
Takes us to your, both of your house.
yeah, that does kind of collide, I think, a little bit with other memberships ending. I don't remember. Jason, those are at the end of January? Oh,
Oh, sorry. I heard somebody in the hall. I believe that even though it officially ends, we've had members that it expired at the end of the year, and I think staff at that time told us that they were still able to be on the commission until their chairs were filled. So as long as staff could confirm that, I would just personally stating that I would be open to having something in January.
okay, and it actually does say it actually expires on January.
January
30th.
31st, I thought.
So that should work pretty nicely then. So, yeah, so we should be able to, unless anybody else has any misgivings, I think that we should be able to reschedule.
Would that mean that we have two in January then? To make up one and another one, or are we combining them into one?
We will suggest that combining that two meeting in one in January.
And like I told Michelle this morning on the phone, I talked to her, I said, I said, it's really sad because here's Michael, 60 years old.
Was there, I heard from another board that there might be like training for commissions and or boards. Like some kind of like, or at least conversation about training on how these work, or an overarching. Everything about
Is
that?
that something I heard about, like training, but there's the discussing code and conduct.
Yeah, I think
For
maybe
boards and commissions, but we
Jennifer
haven't,
was working on that.
yeah. We,
Learning as we lose our two chairs, I'm trying to get more people on there. I know.
But yeah, we'll confirm with Clerk Crossley, and if there's any further information, we provide.
Thank you.
I'm not paying this child support. That's not my grant.
All right,
They can't make me.
okay, so if there's a suggestion to move to January, assuming do we need to put that on the floor? Jason?
Yes, if we wanted to vote on it now, but I believe that the suggestion was to talk about it this meeting. Yeah, because if we don't, we can't vote on next meeting because it's about next
Yeah.
meeting.
Yeah. Schrodinger's meeting.
Yeah.
I mean, I don't see a problem with that, especially if our tenures end at the end of January, we meet.
We have to do it if we don't really have another option.
Yeah. Exactly. So I suppose unless there's any vociferous objection, we can assume that as assent to that, and then we would just move the next meeting for January.
Yes.
Alright, says we action. Yeah.
Yeah.
Alright, we,
Unless you wanted to formalize the motion to cancel the December meeting, I think then that would be it would show procedural history.
I make a motion to cancel the December meeting and reschedule it for January.
I second that motion.
Sounds good to me.
Jason, you would have called roll.
Yeah. Robert,
Aye.
Cammy,
Aye.
Jason, I, Kale,
Yeah.
Aaron, Karshan, Brigitte.
Aye.
All right, it's unanimous.
Alright, so now, we'll move on to public and comment. Anyone is here? Do you have anything you want to add in addition? Such presentation, okay. Since we moved on to, since we flipped around some of the points, now we can do, we can give the floor to council member Piedmont Smith.
Let's do this.
Something that's a little bit better that I can get around and.
So I sent a couple of documents to, Christine, and she's going to display them.
Yes.
So, if we could just start with the overview of media responder program, there we go. So I've, been through a training course, meetings with Local Progress, which is a national organization of local progressive elected leaders, about community responder programs, which is an emergency.
Ken and I went and got a haircut last night.
We keep hearing,
Yeah, remote people may want to mute just in case. Thanks, everybody.
so community responder program is an emergency response service, that's an alternative to police. And it's staffed by mental health professionals. So it's, often there's, a mental health professional plus a peer counselor on the team, and sometimes there is an MT. And by peer counselor, I mean somebody who has experience either, with mental health issues themselves or with substance use disorder issues or, other issues that they have gone through, so they might be able to relate well to people who are struggling. It's can be run directly by local government, or it can be contracted with a nonprofit. And, I have a link there. I think this document will be shared with committee members. Some of the benefits include that, it's really a more effective response if somebody is having a mental health crisis, to have somebody who's trained to deal with mental health crisis rather than having an armed police officer. It reduces the exposure to armed police, obviously, in these situations. So it decreases the likelihood of the use of force, and entanglement of the person with the criminal justice system, when they're having a health crisis and not committing a crime. In particular, low-income people and people of color are historically over-policed in our society. Because we still do have a lot of socioeconomic segregation, and police tend to focus on certain geographic areas and cities. So those are particularly harmed with police interactions sometimes.
And so this is a good alternative to
Mhm.
situations where there's not a crime, but there's somebody just in distress and acting in a strange way. And it allows police to focus on responding to and investigating and solving violent crime, actual criminal situations. And it reduces criminalization of behavior that stems from mental health, like I mentioned, that is really not a police matter. And shouldn't be, you shouldn't be arrested just because you're hearing voices and you're talking to somebody who's there. You're not hurting somebody, right? It also diverts calls from the fire department, emergency medical services, and from emergency rooms, thus reducing costs overall. Because everybody knows, as soon as you step in an emergency room, the the cost of that to the system and to individuals escalates very quickly. So, common features of the community responder programs across the country are, like I said, teams of 2 or 3 responders. Usually includes a social worker or somebody else with clinical training in working with mental health clients, peer counselor, and sometimes they also have an EMT. They are generally dispatched through the 911 system. So this also requires training of dispatchers so that, they know that there's this other option. So they have a new set of questions they have to ask people who call 911. So they can determine, well, if there's no, weapon, if there's nobody actually perpetrating violence or displaying a weapon, then we can send this other team of people to deal with the situation, or somebody is having a mental health issue. Usually, the teams, the community responder teams are limited. There are very few cities where they're 24 hours a day, just because it costs so much money to staff 24 hours a day. But there are some cities that are building up to that. And the CRP team always takes time to not only resolve the immediate emergency, but connect the person to services, and there's always follow-ups. So it's not just one and done. Check in with the person in 2 days, in a week, in 2 weeks. 3 or 4 follow-ups result in most of these systems. When not on specific emergency calls, the teams are out in the community building relationships with people to become kind of a trusted face, a familiar face among people who are unhoused or people who are often out and about, so that there's more trust there when the emergency happens. And there's always some kind of radio contact with police, because a situation may escalate. Maybe somebody does have a gun that they pull out, then you want the police to come. So most programs have found that the call for police backup is very rare, but it does happen. There are many cities, there are dozens of cities that have these programs. Here are just a few of them. And we'll talk a little bit more about some of these on the next slide, the next document. Currently in Bloomington, we have the Stride Mobile service that's run by Centerstone, which is a big nonprofit mental health services provider. But it's not hooked into 911, so you have to know their number separately to ask for that team to come. And there's not that connection between the team and the police, like they're not on the same radio frequency or anything like that. So we kind of have a community responder program, but not really, because it's not integrated into our emergency responses.
And I'll briefly add, they're doing a kind of an ad campaign now, where there's a couple of billboards up, but for other people who have not seen the billboards.
Stride has billboards, is what you're saying?
Correct. Yeah.
Okay, thank you.
So if we can go on to the next document. Makes that bigger. I wanted to give you some examples and compare some of the programs that are out there. I don't know if you can read that, sorry.
Okay. You know, I got the right glasses on.
There we go. Okay, so these are some of the ones I've learned about, and in some cases I've talked to people who are involved in those programs. So in Evanston, Illinois, they have they all have acronyms. They all have clinical acronyms. So the CARE team, don't ask me what it stands for, but they're all community responder programs. In Evanston, it's unusual because it's through their Parks and Recreation department. Because their Parks and Recreation department already had like a youth outreach program where they had they have community centers where youth can come and hang out. And then they had outreach staff there who also went in the community and talked with at-risk youth who they call opportunity cases. I like the positive spin there. And so that kind of evolved into, well, we're doing outreach to these young people, but there are a lot of other people who need help where they are, on the streets or in public. And so they decided to launch the community responder program in 2024. Their Parks and Rec department is now called something else. Well, now community services, so it's more indicative of what it includes. Their teams are comprised of 2 people. The annual call volume is, they've only been around for a year, so I'm sure this will increase, but it's 1,816, which is 24 per 1,000 people in that city. Evanston is about 78,000, so it's just a little bit smaller than Bloomington.
Yeah.
We can scroll down further. Down, there's another. There we go. Up a little.
Up to the top of the page. There you
There we go.
go. Oh. Slippery. Slippery.
Leave that in between.
Let's put a little mark on the side, just do that.
You can just use the arrows maybe to go to the next page. Okay. So per 1,000 residents.
There
is
you
24. Their initial program budget was $400,000, which is not really that much in the context of the city budget. The calls come in through central dispatch. The presenter at the conference I went to said dispatch is our #1 champion. So they, the people that work for central dispatch were on board with this. They thought this was a good idea and they were engaged in the training. Dispatch is run by the city. In Monroe County, you may know, the dispatch is collaboration between the city and the county government, but it is run by the city. Those are city employees. So if we talk about co-response, that means the community response team goes out at the same time as police. So that does happen in Evanston. They either go out with police or they go out without police, depending on the situation. For some of these, I had various bits of financial information. So the one thing about Evanston, they did not move any funds out of the police funds. This was an addition. And very interesting, they have partnered with a local community college to develop the training that their team members get. So they were like, we're starting this new program, but we don't, can you help us by training folks? So rather than just employing people who have like a degree in social work or other clinical credentials already, I mean, they do look for people with experience of some sort, but they put them through this, I don't know, it was 10-week, 12-week training program. So that was an interesting part of their program.
Did they get an idea how long the training program was? I was taking notes and like, yeah, I missed it.
I don't remember.
That's fine.
I don't know.
Didn't mean to
It's like shorter than a regular semester.
Sure.
Of college, so it's less than 15 weeks.
Okay.
Yeah, feel free to stop me.
I obviously.
So if you can go back up to the top and look at another example. Durham, North Carolina has one of the older programs that's been around a little longer than others. Their a city that's a little bigger than Bloomington. So they had a lot of problems with gang violence and youth violence, and so they started with a program that it's called the Violence Interrupter Program. It's basically saying, teaching kids, you know, there are other ways to resolve problems other than violence. And then that moved into a study of the 911 calls, which 3 years worth of 911 calls were analyzed. They looked at use of force, to see, you know, which situations use of force came about by the police, and trying to home in on those situations where they really could have used an unarmed intervention, mental health professional instead of police. They had a lot of focus group surveys. The police and first responders were involved as the program was developed. 2022, okay, well, that's not that long. I think I was getting it mixed up with Olympia, but anyway. The oldest program in the country was in Springfield, Oregon, in Eugene, Oregon, which has been around since like 1989 or so. Eugene, Oregon has cut that program because they don't have money. Springfield, which is a neighboring smaller city, still has it. Anyway. It's in Durham, North Carolina. It's housed in the Community Safety Department. They have a department called Community Safety. Interesting. They have 3 people on their teams. They have an annual call volume of about 8,000, 28 per 1,000 population. If we can scroll down. Their budget is $2 million. Their calls also come in through central dispatch. They have somebody from the HART team that works in dispatch. So if the dispatchers aren't sure, you know, here's what's going on, the HART team member who's been out in the field can say, yeah, it's okay to send HART. We deal with those situations. So they do have co-response with police or response on their own. They actually did move some vacant police positions into the HART program. So,
And that was how they funded the 2 million. Partially was
partially was,
moving that.
yeah, using some lines in police, in the police budget and moving those. So their examination of 911 data showed that 90% of calls, I think that was supposed to be calls, didn't have anything to do with violent crime. So there were a lot of calls that could be eligible for HART, is what they found when they did their analysis. And less than 1% of calls prior to this program it ended with an arrest. So the police time was really spent on a lot of things that were not. And since the program started, of course, the police have gained some of that time back as part of response. Next example, I think, is Denver, big city. That program is called STAR. So they started out with a program within the police department that paired a police officer with a mental health professional. And then it expanded into just being a mental health professional community responder team. Started in 2020, it's through the city health department. They have a contract. So these people in this community responder program in Denver do not work for the city of Denver, work for a mental health provider that has a contract with the city of Denver.
Does that change their training at all, if they do Denver? Like, is it then done separately and then they just?
Yeah, I think so. So the mental health nonprofit would provide the training. So they have 2 people on each team that they send out. Their annual call volume is 7,657, so that's lower per person. Than some of the others, only 11 per 1,000 population. They have a much bigger budget, big city, a lot of area to cover. They go through central dispatch. They have, sometimes they go with police, sometimes they go on their own. As I said, they have a contract, Mental Health Center of Denver.
Is the mental health center a not-for-profit or a?
Yes, it's nonprofit.
Yeah.
And in the first 4 years of the program, 41% of individuals served were referred to mental health, to formal mental health or substance use services. So that's actually seems low to me, but and 38% were actually transported, so they were driven to a resource so that they could go there, get food, get treatment, whatever they needed. A lot of what Stride does as well, locally as well, we'll get you some. Is this one. All right, the next one is Olympia, Washington. So that has a population of 55,000. That's smaller than Bloomington. It is the capital of the state of Washington, so a little bit different demographics that we have. They got grant funds. Their state of Washington Police and Sheriff's Association actually gave them a grant to have a community responder program. That is perhaps why they are housed within their police department. Their people work for the police department. Let me see. Their teams are 2 people. They answer a lot of calls, 2,000 for their community. That's a lot per year. That's 36 per 1,000 population. Their budget is pretty small, 550,000. Their calls come through central dispatch. And yeah, they also have their teams, the crew teams, help identify which calls should come through them. They have both teams that go with police and teams that go without to the calls. So they started out as being contracted the service to a nonprofit, and now the city has taken this over their city. There are parts of Olympia where the crew teams will not go without police. So I thought that was interesting that they somehow have judged that it's likely to end in violence if you're going to that neighborhood. So I don't know what they base that on, but there are a couple of neighborhoods they won't go on their own. Yes.
Since these staff people are out of the police department, are they sworn officers?
They are not sworn officers.
They're dressed like what, because even like our downtown police officers still look like officers.
Well, they are sworn officers.
Yeah, they are, okay,
Police
so.
officers. Yeah.
So I was like, I wondered how they're dressed or how they're perceived by those neighborhoods, no matter what.
Yeah, I think I saw a photo of the crew team and it was like polo shirts.
Scary.
Scary.
Of course.
So just up the highway, Indianapolis has a community responder program. It's called the CLCR, Clinician Led Response. They started by having a team within the police department called MCAT, not to be confused with that exam you have to take when you're in law school. They started with that, and then community activists said, no, we want an option that does not involve police. And part of that is because a couple of mental health crises were met with police and the person died, the person was shot or tased in the case of Hermite Whitfield. He was tased and he died. So, there was a lot of activism, especially among the Black community, to create a non-police, program. So it is run through the Office of Public Health and Safety through a contract with a nonprofit. Their teams are made up of 2 people. Yeah, scroll a little bit. So they're pretty low on the number of responses. They do not cover all of Indianapolis yet. They are gradually expanding. They started with just downtown. Now they've added several other neighborhoods. So it's only 1 per 1,000 population right now. Not great, but they are trying to expand. Their most recent program budget I could find was $2 million. They are dispatched through the 911 system. They do not go with the police. They are on their own only, because the police still have their MCAT thing. So the contract is with an agency called Stepping Stones Therapy Center. And I guess the unique thing is that they do have this police entity where police and social worker go together and separate from the only communities under only police. Which kind of takes us to Bloomington, which is the last column, because we sort of have that as well. I think everybody here has heard of Stride Mobile. The Stride Center developed with private and public support as, first of all, just a location, a third option when somebody's in a mental health crisis and they encounter, somebody calls the police or they encounter the police. The community wanted a third option between sending them to the hospital or sending them to jail. Because they needed to be connected with help, with social services, mental health care center. So that's how Stride came to be in 2020, and then Stride Mobile developed from there in 2023. It's the only one I've come across where it's not, has no connection with city or county. It's its own independent thing. And they have 2 people teams. Our specialist and peer counselor. So the data I got from them is about a year old. So they, with the marketing campaign and everything, these numbers are probably going up. But they had 518 responses in the first year. I don't know what the budget is. The calls do not come in through central dispatch. You have to call a tentative number. They sometimes do respond with police. Sometimes police will actually, when they're on a scene and they see that it's a mental health situation, they will call Stride. So they sometimes are responding with.
500 out of our population, that's less than 1 per 1,000. It suggests that there would probably be more if they might be in the dispatch system.
I think for sure they would be fun.
Do we know, is there, has this ever been discussed? Do we know if there's a history and why it might not have happened yet? Do we know anything about that? Was there forces in the city or that? Are there hearings that make it that it could be discussed or?
I mean, this is something I've been talking to city leaders about for a couple of years.
Okay.
And these types of programs feature prominently in the 2023 report that this commission wrote, right? Yeah, community responder programs. And and Tammy and Jason can speak to this as well, but the number 1 recommendation was to investigate whether it would make sense to have a Department of Community Safety, some sort, phrasing all right.
Yeah.
Department of
orders-
Community Safety and Resilience.
Resilience, yes, thank you.
Yeah.
And so it's been like pulling teeth to even get the city to consider creating such a department, which would start with a study of our 911 calls. So, John Hamilton's administration was in its waning months when the report came out, so they weren't going to take the initiative. Mayor Thompson has indicated some interest, but is very wary of replicating what already exists. The police department here, as you probably know, employs 4 social workers. And actually, the mayor just came out with a report today about how her administration has dealt with homelessness. And there's a section in there about non-police response, where she talks about stride and so I don't know why that connection hasn't been made between stride getting into the dispatch. But I think it also has to do with our central dispatch being in disarray. I mean, that's kind of inside baseball, and I don't know the details, but there have been some tremendous staffing shortages, dispatch, and some management problems. So I think the Thompson administration has been focusing on just stabilizing that before asking them to, weigh in on could we route these calls to you. And I did meet with Linda Grove Paul from Centerstone, who oversees Stride a few months ago, and I don't think they're averse to. Didn't get the feeling she would think it was a bad thing to go through dispatch, but she's also part of a multi-state big nonprofit organization that has their own procedures, their own governance. So, we would have to hash out a contract with them and say, what are they going to do? What are we going to do? How's the interaction going to work? So there are a lot of things to think through. I just think our community hasn't gotten to it yet.
And that is all that contract would then be with Centerstone. In theory.
In theory, yes.
And they're the multi-state, yeah. I didn't realize they were multi-state.
Oh, yeah, they just added a couple more states. Yeah, they're big.
I wonder if they do have contracts with other states as a template.
That is a good question.
I was gonna say, do you know what or is there arrangement, even if it's not like, is it exactly like Stride in other states, or is it changing depending on the cities of the area?
It's really depends on the city, each one is little.
Amongst all of your research of all the different cities, is there things that you've learned that with our current system of Stride being where they're at and where the city's at, are there like recommendations that you've learned as you studied the different cities? Like going through Stride being the good thing, or thinking elsewhere, or like as you've worked through different cities, seeing the positives and the cons, is there any recommendations you have for our city that you like, a few foundational ones or anything?
I have other experts have said that it's most beneficial for the employees of the community responder program to be city employees. There's more stability in that. You should get better applicants from through that. The city is a well-established entity that has, some credibility in the community and has good benefits and things like that. But there are also, communities like Pittsburgh, Allegheny County, which is where Pittsburgh is. Although the city of Pittsburgh doesn't participate, but Allegheny County has this community responder program. And they speak very highly of the nonprofit that they have contracted with. And I really think that they've done a great job as far as training, and that I think that that it could go either way. If you're contracting, you know, devil's in the details. To have enough say, the city to have enough say in it. So they're not micromanaging the mental health professionals. City administrators are not expert at that. And yet they're still adhering to the same principles as that. So I think both could work. I mean, here we have Stride. They're doing it. I think going in a different direction would be counterproductive. There was something at the bottom of that document about Stride and that they are a 5-county operation. Stride Mobile serves 5 counties. So those numbers were over 5 counties. Now, most of them were in Monroe County. They have a Stride location also in Bartholomew County, Columbus, Indiana. So a lot of the calls were there too, but so when you look at the numbers as compared with other cities, these are so low for Stride. And, you know, Linda Grove Hall got a little bit defensive and saying, oh, we can handle it, you know, because I was like, oh, it's great, you're gonna do the whole marketing, but we don't have enough people. She's like, oh, we can handle it, we can hire more. So, I don't know, if we're really going to go through central dispatch, I think the number of calls that we would want to send their way is gonna increase exponentially. So, they would have to be ready for that, and I don't know what their capacity really is.
Do we know where they get their money? Just thinking ahead, whether they will have funding in the long term or how that.
I think they do rely on some grant funding. So I don't know how stable their funding is over the coming years. But Stride Global is being held up in the state as an example for other communities as well. Yes.
So, and I was looking through the addendum with kind of the 911 kind of report that was appended in the packet. And one of the options implementing the social worker and dispatch, it says that it is funded. But because of those staffing problems, do we know if that is one of the positions that still is not filled because of those issues? Do we know that? Often.
Good question.
Okay.
It was vacant for a long time,
Well, and I thought I remembered that too, but I didn't know.
but I don't know if
Somebody
they
has
may
that.
have filled by now. I'm not sure.
So it sounds like some kind of follow-up might be good to get a pulse on the current dispatch situation at some point. Soon.
I
Well,
thought
and-
I thought they had the first position filled and they were trying to find the second social worker.
Yeah, I don't know how many vacancies they had, but the specific position, I guess, that Robert was asking about is the one in the central dispatch.
Yeah,
No. Tammy, if that was filled,
I thought they were still having problems filling it, but I'm not sure.
yeah. Yeah, and I don't know why. It has such trouble filling it, you know, because it was in dispatch and our dispatch was a little bit discombobulated. Salary, but just to remind you, because I think I've communicated this before, so we do. In the 2025 budget, time is ticking. There is $10,000 that is supposed to go towards a study of our 911 calls and whether they could be addressed by non-police responders. And I've been nagging Deputy Mayor now for months now to try to get that money spent on a contract to do that stuff. And I still don't.
So
They were looking at two different entities that do that kind of thing,
Yeah.
and I still don't know whether they decided on one and are going forward.
That's not something that we, as a body, have much power to try and push that.
Is there a way we could
Satisfied.
support that push?
Yeah.
Like,
I mean, the
I don't know how
US
this thing works.
Commission
Yeah.
could, you know, send a memo or a message to the mayor's office saying, like, to follow up on this, because it came from your 2023 report.
Yeah.
Like, this was the first
So
tiny
it's-
little step that he's,
It's in the thread still.
Yeah.
Okay.
so you could like vote to send a message to the mayor's office inquiring about it.
I second that, right, so she was joking.
For the 2025 budget, you said? What happens to that if we don't, if it's not used, does it go like, does that?
It goes away.
It's, we can't.
It's not reallotted.
You're gonna see, oh, shoot.
And fiscal year for the 2025 budget ends when?
December 31st. So, I mean, the work obviously doesn't have to be done in 2025, but the contract needs to be signed,
Yeah.
that purchase order.
Is that something, is this message or email that we send, is that something that we can do separate from each other and then all agree upon and like email and send or something? I know we can vote on making it here, but what's that like? Cause we're not gonna have a meeting in December.
I was gonna say, I think,
So,
I think that now we've got a pickle that where we're not meeting December, but fiscal year ends in.
if one of us, write it and we all share it with each other and then. You know, what's that?
You can't deliberate via email.
Yeah.
These are the things that do not do.
How much time would it take us to write one now? Is that a naive question? Like, is that?
I mean, it could be very simple,
Yeah,
Could
right?
be simple,
2
right?
sentences.
Yeah.
Mhm.
Here's the wordsmith.
I'm also wondering, because as a commission, we've coordinated and spoken up at city meetings, specifically the ones deciding the budget. I'm wondering, since we've sent back channel communications with the mayor's office and have kind of gotten those plans kicked down the road because Kerry's administration wasn't willing to look at them right now. Would it be effective to show up at a city council meeting to get that on record? To either speak on behalf of the commission or as private individuals referencing the report? Would that add a little heat to kind of considering that or looking at that?
It wouldn't hurt, but then you're talking to the city council, not the mayor.
Right.
We could,
Yeah.
we do both.
Do both?
Yeah.
I'll show up to anything.
Mhm.
I'm showing up to thing tomorrow. So if we have sent a memo, I can be like, hey. I want that. Here's the memo. Have a meeting. But. I'm not great with words, so I will.
Who do we write to? Like,
You-
the mayor?
You could write a letter to the mayor and write a letter to the editor.
Okay. The editor?
Well, that's
Of
a
the
whole
news-
lot.
Oh, yeah, that's.
That's taking it public. I don't know if you wanna do that. I mean,
Yeah,
that's a decision we make.
We could always send our simple thing first and then if we don't see response, then if we want to. Follow up with it in a different way, we could.
I would be okay with that. Other thoughts?
For any initial action, we have to meet in person if we wanted to draft an initial letter to the mayor and then for the next step.
no, you don't. You can write the email, send it out, have people add what they think should go onto it, or what they like or what they don't like, or how they think the email should go. You can send that around and everybody can comment on it. And then write it up as an email after everybody has commented on it.
That sounds like deliberation, though.
Yeah, it's kind of.
Right?
I thought we
discussion.
could do that. We've done it before.
No.
That, yeah.
Yeah, we don't, we think that that's sort of like receiving information between members, so that should be during our meeting officially here during it.
Let's just write it now. Dear Mayor. Right? For what it's worth, I don't know.
Or we can have maybe co-chairs to draft that, like and send it out.
Yeah, I think in the
So-
past, when we've done things, we've sent out a draft for people to consider and then bring their comments to the next meeting. Rather than.
Yeah.
The next year, right?
That's January.
That's January.
Right, I know, I'm just saying, that's probably what
Right, yeah.
we were.
So we're,
Are you writing something?
I think my guy here is attempted something, like put the pressure on. But I'm still kind of aware of how the procedure works, but I'm definitely down to get something out while we're out here.
Yeah, I mean, what do we have to lose? And again, this might be a naive question,
$10,000.
because I'm new to this. Yeah, if we don't try, or if we have, like, what do we have to ask to lose by asking, right?
And also that's the. Was suggested by the previous, and then also ties into all the things that we wanna see, so.
Yeah, in several discussions, it has come up that we we really.
It'll be a resource for the future too, so.
Yeah. Robert, do you want input, help? Okay. I'll let you think.
I can talk all day, I cannot formulate sentences.
I find that hard too.
Yeah.
All right. Are we ready?
Yeah.
Yes.
Okay. Yeah, I look up there. Pretend like I'm looking at you.
Uh,
Okay, possible note, so we can address however we want, but, it is our right again. It is our understanding that the 2025 budget allotted money to perform a study of the city's 911 calls. We're hoping to get a follow-up or update on this process in light of the end of year approaching. We would appreciate any update you give. Will this funding be able to be moved forward to next year? Love.
Perfect,
It's great. X's and O's, cats.
yeah.
So that's my.
Happy Thanksgiving, Merry Christmas, Happy Kwanzaa.
All the stuff.
Maybe we can add that with like any solution that we're thinking about kind of stops at this, having this critical data, right, to make it good, like.
Yeah, I referenced the 2023 report.
Yeah.
This data is critical to our work.
Yeah,
For our 2023 report.
yeah, per our
Which is-
2023 report.
we're not just writing to annoy you.
I do that every day anyway.
It's my job.
All right, so yeah, it is our understanding that the 2025 budget allotted. Allotted money to perform a study of the city's 911 calls. We are hoping to get a follow-up and or update on this process in light of the end of year approaching. We would appreciate any update you could give. Will this funding be able to be moved forward to next year? This study would be critical for our work related to our 2023 report, so would appreciate your assistance.
I would edit, this study is critical to our work. To our mission.
Yeah.
Per. The 2023 study
Yeah.
or report, yeah.
All right, I second that, and I've made that edit.
The only edit I was thinking about is that last sentence, will the funding be able to move forward
Yeah,
to next year if the contract is not drafted by the end of, you know, some kind of like. Put a little more pressure on, get it done, but also into the question of, if you're not planning to. But I don't really.
If it's not completed by the end of the fiscal year.
Yeah.
Yes, move it, but don't just do that, because we asked. Maybe just finish it. Thank you.
All right. I made those changes. Shall I read it again?
One more time and then we vote on it.
Can you
Yes.
write, can you write as that okay, that it was also not just per the report, but also the special committee meetings that we had with her?
Yeah.
Because I sat in several special committee meetings that we had with her, and it was discussed in them as well.
Okay, so like per our 2023 report and the special committee meetings,
That we had directly with you.
With her.
yeah, that we had directly.
Hmm. Okay. You ready?
Yes.
Hopefully I won't trip over my own tongue here. It is our understanding that the 2025 budget allotted money to perform a study of the city's 911 calls. We are hoping to get a follow-up or update on this process in light of the end of the year approaching. We would appreciate any update you could give. Will this funding be able to be moved forward to next year if a contract isn't completed by end of the year? This study would be critical for our mission for our 2023 report and special meetings members of our committee had with the mayor's office. So we would appreciate your assistance.
The wording contract completed, does that mean the contract has, like, I'm not a lawyer, but what does that mean, the contract has to be signed, or does it mean the contract has to be like fulfilled?
I would say, yeah, I don't like the word completed, I would use perfected or executed.
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 Or can we suggest that the funds depleted or something, right? But I don't know.
Executed.
Executed.
Like the contract being executed would mean that the contractor has done the work, and that's not gonna happen, right? Does it
Executed
have
means it's signed.
Started.
sign? Okay.
I defer to the lawyer.
Enforceable.
Oh, you're a lawyer? Okay, good.
Sorry, lawyer.
Good.
I'm happier though.
Thank you.
She knows some lawyers.
All right, so I have that as a draft. I changed that one word to executed. Shall I read it one more time, or are we satisfied enough to put this to a vote?
One more time?
I think at one point you used the word committee, but this is a commission.
Or commission?
Yes.
It's because it was a special committee that met with her for the commission. And it was called a special committee meeting that we had with her because it was a special committee on behalf of the commission.
Right.
All right. I think I've made that. It is our understanding that the 2025 budget allotted money to perform a study of the city's 911 calls. We are hoping to get a follow-up or update on this process in light of the end of year approaching. We would appreciate any update you could give. Will this funding be able to be moved forward to next year if a contract isn't executed by end of the year? This study would be critical for our mission per our 2023 report and special meetings members of our commission had with the mayor's office. So we would appreciate your assistance.
Good enough.
Yeah.
I move that we accept this email to send to the mayor's office.
I second that.
Me too.
All right. While I'm writing and saving this, can you call?
Yes, absolutely.
Thank you.
We'll start on the other side of the table and go backwards this time. Brigitte,
Yes.
Karshan,
Yes.
Aaron,
Yes.
Robert, Kale,
Yes.
Cammy,
Yay.
Jason. Yay. It is passed unanimously.
All right. Is this something that, I guess, who is sending this?
Probably should be come from one of our co-chairs.
Yes, that means it's me, since it's in my notes.
You can burn bridges if you're relocating anyway.
What is the email? What is the email to,
Mayor@bloomington.io.
Nice.
mayor at Indiana.io?
Yeah.
Bloomington,
Sorry,
Bloomington, that name.
Dot IN.
Dot.
I will send that in the next day or so.
Here's star. Here's star.
Excellent.
No, but they do it. We could call the mayor's office. Okay. We might wanna wait and see what response you get.
Yeah. And when's the next city council meeting?
7:30.
Okay.
Okay, so
So maybe if you have her by then.
So in the next day or so, I will send with my account as a commission person to the mayor's office. And as far as reporting back, I should be able to just forward that to everybody, but not expect responses, and that should be, I think that covers without, since we're not deliberating over it.
Yeah.
That's what I thought. And of course, I would CC you fine folks, just to keep everything transparent and on the up and up.
Sounds good.
All right. Well, I know we did not get to the old business, but in some ways, I feel like that kind of a little bit got covered with this. Would you agree with that, Jason?
Yeah, that's what I was going to suggest.
Okay.
This kind of addresses that.
Yeah, which means our, I think even our old business is now kind of covered with this. So I guess in the interest of time, since it's 2 minutes after, I move to adjourn this meeting.
I second it.
All right, so we'll start with the remotes. Amy? Amy, do you?
Yay.
Yay, Jason?
Yay.
Taylor?
Yay.
Bridget?
Yay.
Carson?
Yay.
Aaron?
Yay.
Robert says yay, meeting adjourned. Thanks, everybody, for being here, especially thank you.
You're here.
I don't think you have to vote on it.
Hey, we did.
Warming
I don't know where I'm to.
up.
I'm making stuff up.
We never do it passive.
Okay.
For sure.